According to the Oregon Health Authority, the number of COVID-related deaths and hospitalizations is declining, but the number of statewide cases is trending upward. Fox 12's Sarah Hurwitz spoke with a legacy doctor on why this may be happening. Sarah?
Oh yeah, that doctor I spoke with says this may be linked to how the vaccine works, which doesn't prevent you from getting the virus, but it does decrease severity. In the Oregon Health Authority's weekly report, it cited a 31% increase in statewide COVID cases from March 8th through the 14th. And according to OHA, hospitalizations dropped slightly, and COVID-19 related deaths fell from 86 the previous week to 26.
And one of the goals of the vaccine isn't really to prevent COVID illness, is to prevent severe illness. So you can still get COVID after the vaccine, but you're less likely to get hospitalized or die. And so that would explain the increased numbers of disease without the hospitalization, at least partly.
Legacy Health Dr. Joseph Dang, who has been treating COVID patients throughout the pandemic, says that one of the goals of the vaccine is not to prevent COVID illness, it's to prevent severe illness. Now, according to Legacy Health, as of Thursday, there were 22 patients being treated for COVID across its 6 hospitals and 3 in the ICU on a ventilator. That's compared to December 1st, when Legacy says it was treating 149 patients for COVID. Right now, Dr. Dang says he's seen fewer COVID patients, but he says it's now being filled with patients who have other illnesses.
Part of this is because people have delayed care, or their care has been changed from in-person to online, and we do see consequences from that. I'm not saying that that was the wrong thing to do, but we are seeing people who have non-COVID illness and they're quite sick. So the hospital's still very busy.
Dr. Dang says he's optimistic about the next year with the vaccine rollout, but is still cautious. He says the future all depends on how people behave before vaccinations roll out for everyone.
If we get too many people infected before everyone's vaccinated, every infected person represents millions and billions of mutations. And each one of those mutations is a chance for the virus to become resistant.
And Dr. Dang says that there is no specific pattern in terms of the other illnesses that he is seeing in the hospital right now, but he does say that some illnesses that are linked to alcoholism and substance abuse, those are more common. Reporting live, Sarah Hurwitz, Fox 12 Oregon.